Hi, thanks for joining us for the community chat today. We're going to be speaking with CEO Karen Joyner of the Virginia Peninsula Foodbank. So we're going to get started. I see people tuning in on Facebook, and we're also on YouTube and wavy.com. Karen, thank you so much for joining us today.
Thank you for having me.
I think that this is always a timely conversation, but especially right now with rising food prices, potentially a drop off of certain events and such after the holidays. I just think it's important to, make sure that people know the resources available and then also how to give if they are on that side. So I just wanted to start. Can you just tell us, the organization's been around since the 80s, but can you just, tell us a little bit about Virginia Peninsula Foodbank and your role?
Absolutely. Virginia Peninsula Foodbank has been around since 1986. We are the largest hunger relief organization across the greater Virginia Peninsula, and we are responsible for making sure that anybody who is in need of food assistance can find it within the cities and counties of Hampton, Newport News, Poquoson, Gloucester, Matthews County, James City County, York County, Surrey County, and the city of Williamsburg. We work primarily through a network of partner agencies that for us tend to be faith-based organizations such as church food pantries. And we have about 140 partners. And that is our largest method of distribution. About 63% of all the food that goes out from the food bank goes out through our partner agencies. But another 25% or so goes out through our mobile pantry program, which is where we take truckloads of food out into the community and serve individuals directly. Since COVID, these mobile pantries are truly mobile and are drive-through pantries where people just bring their car and pop their trunks, and our volunteers will put the food in their trunks. We have about 13 of those that are open to the public every month. And then we do another 12 or 13 that are not open to the public, but are at low-income senior living facilities where our volunteers and staff deliver the food from the truck to the doorsteps of those individuals. A lot of things have changed since COVID.
Right.
And then we also operate several child nutrition programs specifically for children. Although a third of everybody that we serve through all of our food distribution programs is a child. A lot of people think that the backpack program and our kids cafe program, our school produce markets, and our school pantries are the only way that we feed children. But really, a third of all the households, all the members of the households of the people that we and our partner agency serve are children. So
Wow.
those are our primary methods of getting food out. And we also serve individuals at the food bank on an emergency case basis.
Mm-hmm. And, I guess one question first, just about your role is how long have you been at the food bank?
April 1st, I will have been here 10 years.
And what have you seen over those 10 years in terms of, maybe the need in the community or just how things have changed?
The need has definitely gone up, not just because of COVID, just because of inflation. Food banks have had to evolve by coming up with more innovative programs to ensure that we take food out into the community rather than expecting the community to come to us. We have definitely increased the nutritional value of the food that we've distributed over the years. At least a third of the food that we distribute is fresh produce. We purchase that produce because we get some donated, but not very much. So we purchase tons of produce every single year. Last year, we distributed about 3 million pounds of produce. So we're very in tune with what people are putting into their bodies. We don't want to be the reason that they have chronic diseases. We want to help them fight chronic diseases by providing more healthy um, food for their community. Um, you know, the donated food that we get, we can't always choose what is going to be donated to us. And so a lot of times we'll get chips and cookies and candy after the holiday seasons donated to us. So that's why we're very cognizant of providing the offset to those bad foods, which everybody loves, but we don't want to be part of the problem. We want to be part of the solution. So we do try and provide more healthy food when we purchase what food we have to purchase.
And that's so interesting just because I actually was speaking with a family medicine doctor on Tuesday, and we spoke about the rising cost of food prices, how expensive healthy foods are for, the average person. And so a lot of people end up going to get fast food or getting, unhealthier food in exchange just because it is at a cheaper price. So, that seems like such an important piece that you're not just providing food, but you're providing food to help.
Absolutely. We operate several food as medicine type programs. Prior to COVID, we were partnering with Centera Careplex, and we had a wonderful program going on there for people who presented themselves with congestive heart failure. We provided the food. There was educational component there. And then COVID shut that program down, and we haven't gotten it started again, but we are partnering with Riverside Health Systems and providing the education and the healthy food for their food as medicine program that has just finished its pilot stage. Actually, I guess next week will be the last class for that cohort of individuals who have high blood pressure. That's what they chose to focus on. So we're the resource for the healthcare providers to get healthy food as well as some nutrition education to go along with that.
Mm-hmm. And is the reason that it's difficult for people to donate because, it isn't something they have on hand like cans or pantry goods? Or is it, what is the length of time that those items can be, okay in your food bank?
Well, of course, we have lots of refrigeration and freezer space. However, we have to guarantee from a food safety standpoint that what we call the cold chain has not been broken. So we do not accept frozen items from individuals that just, like walk in from the street, other than turkeys at the Thanksgiving time. We have to guarantee that it's been kept at the proper temperature the entire time because we don't want to be responsible for anybody ever getting sick from any food that we distribute from the food bank. So that's why we ask for shelf stable items, and then we will take care of buying or getting donated from corporate partners such as Smithfield Foods or our grocery store partners, those other frozen meats and items such as that. We do get produce donated from individuals from their gardens, but it's not in a large enough quantity to be able to serve everybody that we serve. So that's why we get a shipment of different kinds of produce every single week here.
And with your corporate partners and such, or other partners in the community, is it easier for you all to, if able, to receive monetary donations, and then you all partner with organizations to find food? Does that end up being, more economical for, the food bank to find certain items?
Absolutely, absolutely. We can provide 3 meals for every dollar that we get donated, and the way that comes about is because we use a lot of volunteer labor. So we only have 37 staff members that we have to pay, and we receive about 25,000 hours of volunteer time from the community every year. So we don't have that expense. And then we do get a lot of donated food. So we're able to take the monetary donations that people give to us and go out and buy items that we need to provide the other part of the nutritional side.
Hmm.
And then of course we also rely heavily on federal food programs such as the Emergency Food Assistance Program and the Commodity Supplemental Food Program for seniors. They provide, between those two programs, about 25% of all of our food is coming from the federal government. So that's free to us. All the food's
Right.
free to the recipient. So, monetary donations go very, very far with us, and it enables us to supplement the donations that we get, as you see on the screen, all those canned goods and some of the dry goods. Monetary donations enable us to pay our regular operating bills as well as purchase a lot of fresh produce. And on occasion, we'll have to purchase meat, frozen meats in large quantities.
And that $1 for 3 meals, you say. So I was on your website earlier, and you all have this map that you connect to, Think Through Feeding America, that sort of says what the average meal price is for certain areas of the country. And down here, I think the average meal was $3.26, or was around that number.
That sounds about right.
Yeah, and so you're really giving it's a third, compared to what somebody might be able to go out to have 3 meals for that $1 that you just said.
Yes, yes.
Yeah.
Like I said, that includes
Right.
the fact that we are receiving 25% of all of our food from the federal government for
Hmm.
free. And then we have another large portion that's donated. So the only food that we pay for would be the produce, and we buy all the food for our Food for Kids backpack program, where we're giving out bags of nutritious food. These are canned and dry goods to over 1,500 children every single weekend. So when they're out of school, they have some food at their house. We buy that food because we want it all to be consistent across all the children, and we want it to be nutritious. So that's one of the things that we use our monetary donations for, is to support that program. And that program is costing us between $250,000 and $300,000 a year. So those are some of the ways that we utilize the monetary funds that people send in to us.
Absolutely. And, on the subject of, your backpack program and feeding kids, especially at school, I mean, how important are those meals they're getting from school? And then you all supplementing that with your backpack program? Like, that is, where people get their meals so much during the week. Can you just talk a little bit about that aspect of the food climate right now?
Sure, absolutely. Even before the inflation that we're seeing now, hunger in the communities that we serve, particularly Hampton, Newport News, and believe it or not, City of Williamsburg, they all have a very high food insecurity rate, which means the number of households in our community that don't know where their next meal is coming from is very high. The overall service area has a 10.2% food insecurity rate compared to a state average of 7.7%. We're second highest of all the food banks that serve Virginia. And that's because of, Hampton, Newport News, and the City of Williamsburg just have high poverty rates. So the children, when they go to school, especially in Newport News, everybody's getting free meals in Newport News. And then most of the people qualify for free meals, even if it's not under the community eligibility program where everybody gets it. And so when they're out of school, they may not be eating very well. They may just be eating chips, or they may not eat anything at all. So we want to make sure that those children especially can learn, and you can't learn if you're hungry, or you can't learn if the nutrition is poor because you're eating junk food. That
Right.
causes kids to fall asleep in school and stuff like that. So we're here to serve all of those individuals and all of those children. And in today's climate with inflation, it's just unfortunately getting worse. And we've seen it in our donations too. Our food donations are way down, not just from our grocery store partners, but also our food drives. And I believe it's because a lot of the people who would normally donate through food drives with us, they're struggling too, and so it becomes harder for them to purchase food for their families. They don't have that much left over to then purchase food for other families. So it's just been really, really tough. Over the last several months, we and our partner agencies have seen a 15 to 20% increase in the number of households who are coming to our doors. So it's the perfect storm. We're getting fewer food donations, more people need us, and the costs are going up. So that's why monetary donations really go far for us.
Right. And then with the extra SNAP benefits that are ending, I mean, that's $95, for meals that, is going to go away. I mean, what do you think is going to happen in a month from now, at least as it stands now, when those end on March 1st?
Correct. March will be the first month in a couple of years that this COVID related program is going away. And I have some statistics here that I ran. It said in the state of Virginia, there's 470,000 households that receive that emergency SNAP allotment.
Mm-hmm.
And the average amount that a household received for just that portion of their SNAP benefits was $187.
Wow.
So you take that away on average, the 95 is the minimum.
Mm-hmm.
You take away $95 or $187 from a household that's already struggling, and it's just going to cause more and more people to be in our lines.
Absolutely. And, I saw that a Congress representative said, they want to extend it. And, a lot of families are going to be left out to dry because of this. And then that obviously puts more pressure on food banks and then some of your partner organizations to be able to supplement, that $185. And that is, that's quite a feat to cover that for a lot of people. Because, I think a lot of people watching probably, they think of food insecurity and they think of, somebody that needs all of their groceries taken care of and they can't have anything. But there is a spectrum too. So you're also going to have those people that are supplementing here and there that also need use of the food bank.
Absolutely. I like to explain it to people that our 10.2% food insecurity rate represents 55,000 individuals in our particular service area, which is the greater Virginia Peninsula. And so we're not just serving those people. Those are chronically food insecure people. But there's another pocket of individuals, especially over the past several years, that I call episodically food insecure, which means there's some event that has taken place that causes them to fall into need, whether it's an unexpected medical bill or their car breaks down and they are working. They're the working poor. It's not that people who need our assistance are sitting at home all day long. The vast majority are working, but they're living on the edge. They're living paycheck to paycheck, and anything can cause them to need the assistance of the food bank or one of our partner agencies. So the fact that the extra SNAP allocations going away, we are planning that there's going to be a surge of additional people in our line that maybe they were making do between their own income and the SNAP income, which SNAP stands for Supplemental Nutritional Assistance Program. So it's just supplemental. It's not supposed to take care of all the food needs in the household, but there's just going to need to be some kind of a place that they can go to fill that gap that they've gotten used to. And with inflation, that amount that's going away didn't even go as far as it used to.
Right. Last night I was looking up, different things before our conversation, and I was surprised to see, but I think happy to see that people were posting on TikTok or social media them going to the food bank. I think in a way to sort of destigmatize, having to
Mhm.
go and having to supplement. But it was really interesting. They were just, sharing their experiences very openly. And they were talking about the need for, what you all do with your partner agencies, this accessibility of having it close to you because gas mileage, that can be a problem, like paying for all of those extra needs to get to the food. So is that one of the things that your food trucks and partner agencies really try to get in those communities so people don't really have to leave to find food?
Absolutely. That is why we search out locations for our mobile pantry trucks to go to. We look for partner agencies in areas where we might not already have partner agencies. And one of the programs that I didn't mention early on today was during 2022, we partnered with DoorDash. And DoorDash is partnered with Feeding America around the country, and they have paid for a large amount of home deliveries for people who are medically unable to leave their homes to come to a partner agency or the food bank or one of our mobile pantries. So we have utilized DoorDash throughout the last year or so, and we're going to continue to utilize that partnership, but we're going to end up paying more of that program, the program costs. But it's very important for those that have no transportation or are shut in for medical reasons. But transportation is a big challenge. A lot of the people that we serve do rely on the bus system, and it's sad that they may have to go and take two or three buses just to do grocery shopping for their family each week. So if we bring more food out into their community, it alleviates some of their burden.
Right. And, I think on that and what the burden is not just for, your neighbor, but somebody that isn't able to travel. I mean, that is a huge relief, to not be worried about how you're going to actually get the thing, but have that thing delivered to your home.
Yes. One of the other things that we do allow is for our mobile pantries, when we have the cars lining up, we do allow people to pick up for their neighbors. So we just indicate how many households are in each car, and we give them the appropriate amount of food to serve them and however many households they are going to pick up for.
And with the people that are coming to, different food banks or drives or different partner agencies, is there documentation required for any of that? Or is it just if you need, come show up and we can provide to you?
Currently, there is no documentation that's required, with the exception of the Commodity Supplemental
Mm-hmm.
Food Program, which is that federal food program for low income seniors. That requires documentation. Prior to COVID, um, we had to complete a self declaration of income form for everybody who came and utilized the USDA food. But since COVID, all we're asking for is last name, zip code, number of children, number of seniors, number of adults in their household. We're not asking for any income levels. And that is a decision that the state will have to make regarding what post-COVID rules are going to be for the use of federal foods. The Emergency Food Assistance Program runs through state organizations. In the state of Virginia, it's through the Virginia Department of Agriculture and Consumer Services. And they are currently analyzing whether we're going to have to go back to the rules that were in place prior to COVID. But so far, so good. It's been 3 years now that we haven't had to ask for income information. We just need those other statistics so that we can speak about who we're serving. So there's very little documentation that's required. And we want to give food to anybody who shows up and asks for food, whether it's through us or through our partner agencies. I don't believe that there are very many people who are scamming the system, because being food insecure is a very private thing, and very few people ever admit that they needed the assistance of the food bank. So nobody's out there, you know, raising their hand saying, I use the food bank, um, even though there's nothing wrong with that. So there's not, I don't believe it when people think that people are scamming the system.
Right.
It's not something that you're going to sell on a street corner.
Yeah. And I mean, and you think too, on the other end of that, that it might be easier for some people to say that they do need the food bank when they don't have to provide, documentation for everything. Do you think that is something that people might feel, going back to sort of destigmatizing things, do you think people would feel shame in sort of giving those numbers out, or having to, arrange things, per their salary or per their job situation, and sort of, announce it? Do you think that that sort of helps people come to the food bank?
It does. It absolutely does. And another thing that it does is it creates a safe environment for those undocumented individuals. They are very leery about going to certain locations to get food assistance, because they don't want to give out information about themselves at all. So right now we're in an environment where we can serve everybody without asking a lot of questions. And so that's the way it really should be. We should be feeding people who need help, and not worrying about their immigration status.
Right. And, with people that come to the food bank, or come to your different partner agencies, do you, like, does your organization, do they ever hear certain things that, they're really struggling with or dealing with, or food items that they really are needing? Like, is there any sort of communication of sort of what you all are hearing on that end?
Absolutely. That's another thing that has evolved in food banking. I'm glad you brought that up. We are now looking at more culturally diverse foods, and we are actually purchasing more culturally
Mm,
diverse foods, because people who don't aren't familiar with food, they're not going to eat it, and then it's going to go to waste. So we want people to eat the food that we give them. And the way that we do that is by being very intentional about what we purchase, and intentional about what we order from the USDA through the Emergency Food Assistance Program, and try and consider all the cultures that we're serving. And it's a very diverse population. So we do try and ensure that there are familiar foods for different cultures, because we want them to eat the food. We don't want it to come back to us in a food drive. We've seen that, and we don't want it to be thrown away. So that's another way that food banks have been evolving, is making sure that you're not just giving everybody the same old food, canned goods, dry
right.
goods, that they used to give out 30 years ago.
And I think that's a pretty common misconception that, it's pantry items, it's canned goods, and that's all that's being provided. But, with you saying to the nutrient dense foods, whole foods, and then also foods that match the foods that you actually would individually want to eat, and have some sort of independence about that. I mean, I think the general public might not understand that, you're not just giving people the leftover cans, out of your pantry.
Oh, no, no, no.
Yeah.
And even the food that we get from the federal government is, it may not always be what people want, but we don't have that much of a choice from the ordering system that the federal government gives us. But it's first quality name brand items. Some of the items are very expensive that we're ordering for free. Um, So we definitely are looking at different cultures and what people really want to eat and doing what we can. It's not always possible, but we're making an attempt. We're part of one of our strategic goals is to measure our food based on what's called the healthy eating research guidelines, or the herd guidelines, which are it's basically um, eat this often if it's considered a green in the her guidelines. If it's a yellow, eat it sometimes. And if it's a red, eat it rarely. We never say you can't eat anything at all, but the red foods, they're going to have more sugar, no, more salt, things like that. So um, we're measuring every type of food that goes out of the food bank as either green, yellow, or red. And then we have a goal to make sure that we maintain a certain percentage of green and a certain percentage of yellow for all the food. So we're holding ourselves accountable when we purchase food to offset some of the red foods
Yeah.
that we get donated.
Absolutely. I'm sure there's a lot of sugary cereals and, chips and things that sort of get left over. But I think, the green and yellow foods, I think that's so important. And I think the average person doesn't, realize that the actual good food is making it to the, their neighbors or different people in the community's tables, which I think is, so important. I know that we only have a few more minutes, so I don't want to take up too much of your time, but, I did want to ask if there was anything that you feel is sort of a misconception in food insecurity, with people you might talk to about the food bank or, people in the community. I mean, how close really is the line nowadays, especially with inflation and rising housing costs and everything, from, needing food on your table or needing assistance?
Yeah. The thing about people who need food assistance, again, you're not going to know that
Right.
your family, your friends, your neighbor is getting help through the food bank or one of our partner agencies. Again, it just if you're living paycheck to paycheck, one little thing can throw you into the need for food assistance. I my office here is um, right next to the ladies in the finance department who answer our phone. And we get dozens and dozens of calls every day saying they need help. And it's really heartbreaking. Um, and they always want to apologize that they need help. And I'm like, come to the food bank. If you can't make it to our partner agency, if you can't make it to our mobile pantry, we will make an appointment for you to come here and get food until you can get to one of those other locations. We're not set up to have a line of individuals coming to the food bank, but we do serve individuals every single day, as 10 or 12 of them, I would say. And we make sure they get produce. We make sure they get lean protein, and then a box of canned goods until they can go to one of our partner agencies. So my rule is for my staff that if somebody shows up, whether they have an appointment or not, they don't go away empty handed, because they're already, I get very emotional about this. It's already difficult for them to ask for help. So we shouldn't make it any harder.
Absolutely. And I think, if anyone's listening or if anyone watches this or if anyone knows someone in need, I think that's, such an important piece for them to know that they are, welcome and they will receive help, from your organization. And I appreciate how emotional I'm sure it is for you. And you're hearing these phone calls from so many people in our community right now and, over your tenure, I'm sure. But I think that brings a question I was going to, ask for. People are calling your finance department or calling you. What is the best way for people to get in touch and figure out the best way that they can be served?
Okay. The best way either to volunteer or to donate or to get food assistance is to go to our website, which is hrfoodbank.org. And if you need food assistance, there's a tab on there that says need food, I believe. Click on that, and there will be a list of our mobile pantries for the month. They happen throughout the month, and you can look to see if you live in Newport News. Well, First Baptist Newport News is one of them, or Gethsemane is on this date, and if you live in Hampton, you can go to the Hampton Coliseum towards the end of the month. But if we don't have a mobile pantry coming up, you go further down that page and you put your zip code in, and it'll bring up all of our partner agencies within your zip code. So that is the number one way to get food assistance, is to look for a partner agency and look at our mobile pantry schedule. And then if they can't find something that's suitable based on those criteria, then they can call us and we will make an appointment for them to come here. And then, of course, our website is a wealth of information. So if you want to volunteer, we have a great need for volunteers. We've calculated we need about 800 volunteers working 3 hours each every single month to make everything happen. Because those boxes that we give out, those backpack bags that we give out to the kids, all of that stuff has to be packed by volunteers. We, at the beginning of COVID, we did it ourselves as staff, and it is exhausting when you only have a few people who can do it. But when you have many hands, make light work.
Yes.
So there's volunteer opportunities on our website. And then if you want to make a monetary donation, or if you want to start a food and fun drive, there's also a tab that says donate. And you can donate online, or you can mail it in, or you can start a food and fun drive.
And these links, and I'll put all that resources, back with this video on Facebook, and then also on wavy.com. So if anyone is looking for these resources, I can list them out and have, the direct access link for all of that as well. Well, Karen, thank you so much. I mean, you can just tell how passionate and how, I was going to say, no, I was going to say emotional. I was going to say, I mean, you know everything from, start to finish for your organization, and you can tell, just how close you are to the cause. And I think, if more people knew that it was people in their community and act like that, I think 3 hours of their time, if they're able, to give that at your organization, seems like nothing, if they're able, to help. So thank you so much for talking to me about the organization and the current food climate. I think, this unfortunately will, continue to be a conversation that's necessary, but, I'm glad that we were able to have it today, and hopefully people will see this as a way, if they were looking for resources or looking for a way to give back to the community, that, they have more information from you for this.
Yeah, I mean, it's a lot of fun, actually. It's a great team building exercise. This morning we had the Newport News Police Academy recruits here volunteering together, and we have a lot of military groups as well. But I'd love to give anybody who asks, give them a tour of the food bank, because more times than not, people will say, I had no idea you guys did this. And by the way, one thing that I failed to mention that is a unique program that we operate is our culinary training program, which is a job training program. And that's one of the things that I could show people who come for a tour, because we have a commercial kitchen where we prepare meals for after school programs for the kids. So that's one program I failed to mention, but come for a tour and you'll see it all.
I mean, that's just an example of how many different, things that you all have going on, really. I mean, you touch so much, within food. And you, in your chef program, you're also helping them develop skills, really, right? As well as part of the program.
Absolutely. Mm-hmm. Our culinary training program's goal is to teach them throughout the 12-week program how they can be the best employees that they can be. It's not just a cooking school. They learn certain things about cooking, but mostly they are learning life skills and job skills like leadership, time management, conflict resolution. It's very disciplined. You have to be here every day, and you get inspected, kind of military discipline. we have partners in the community that call us asking if we have any graduates available because they're looking for good workers.
And I saw one, I think, on your website that has created her own spice company, I believe.
Yes,
Yes.
yes. Diva Dawn was one of our, I think she was in our second culinary training class back in probably 2012 before I was here. We're currently operating our 45th culinary
Wow.
training class right now.
Congratulations. Yeah. Well,
Thank
that
you.
proves to show how successful, it's been and how necessary it is for the community, especially if people are calling you, asking you for alumni of the program.
Yeah, absolutely. We can get jobs lined up for them pretty easily, especially with the staffing issues at restaurants these days.
Absolutely. I mean, I think we've seen those signs everywhere, and it is a hard industry, I think, since COVID, to have to operate in. But hopefully, good customers and good service, and people will be able to support, that industry there.
Yeah,
Yeah.
absolutely.
Well, Karen, if there's anything else that you want to mention, please. I think, one of the benefits of this is there isn't a time that we have to, get off. But I think there's people that have been tuning in and, listening along with us. And so, but I don't see any current questions. So I just wanted to turn the floor over to you if you had anything else.
No, I think that I probably talk too much and
Not
covered
at
a
all.
lot. But again, those pictures that you've been showing tell our story, and part of the story that's not being told there, they can come and learn if they come for a tour. And I'm very willing to give tours. Not just me, but other members of our staff can give a good tour anytime somebody requests it.
Okay, great. And I can, I'll put that in the resource article as well. Hopefully people get out there, can see all the work you're doing, on the ground there.
Yeah.
But
And they can contact me directly at kjoyner@hrfoodbank.org.
Thank you for saying that. And I can put that in there as well. I mean, I think having a direct link of communication is one of those things that people get stuck with, not having that. And so I think, the transparency that you all seem to have, in communication and resources, I think speaks volumes, to your organization.
Yeah. We're an open book.
I think people will see that, and hopefully they'll, tune into this, and if not, head to your website and just know, how available you are in the community, and how widespread and how available you are. But thank you so much. And thank you to everyone that was tuning in today. If you have any questions, feel free to leave them in the chat. And then, we'll figure out if that's something that was in this conversation or maybe should be a part of a future conversation. So, Karen, thank you so much. I really appreciate all the time you gave us. And we'll see everyone next week for the next